I'm Nigel Edwards. I work for the Nuffield Trust, a think tank which looks to improve healthcare in the UK. By crunching the numbers, we try to find out what's working and what isn't. With an election coming up, politicians are increasingly pitching the UK's four health systems against one another.
Stand by! Go!
In Westminster, the Conservative claim has been that the Welsh NHS is falling behind under Labour in Cardiff. But is there any truth to that? I wanted to come to Wales to find out. First stop Swansea to meet John and Gaynor, whose mother Gwen waited around 2.5 hours for an ambulance.
She fell in the garden and she was on the floor. She was cold and damp and we had to put blankets on her and hot water bottles.
And when we phoned the ambulance, they told us it wasn't life-threatening.
No,
I mean, a 92-year-old woman laying on the floor and it's not life-threatening. I just can't understand it.
The Welsh Ambulance Trust is still investigating what happened, but Gwen is far from alone. A&E and ambulance waiting times in Wales are lagging behind England and are a cause for real concern. Just 56% of ambulances respond to life-threatening calls within 8 minutes, compared with 70% in England. So why is that? Well, the Welsh NHS has got to work harder because its population is sicker and poorer than England, which creates extra pressure. But it may also be down to money. The Welsh Government has cut health spending in real terms, whilst the governments in England and Scotland have ensured that health spending has kept pace with inflation.
Ward 7 is now ring-fenced again. They have 3 male and 2 female available.
At the Royal Glamorgan in Llantrisant, their figures for A&E waiting times are better than the Welsh average, partly because of the daily meetings like this, which aim to get the patients out of hospital as quickly as possible to keep beds free.
It's not just about what happens within the A&E department, because it's blocks in the system that we have to remove. In the front door, it's about making sure that we have the best use of ambulatory care so that patients don't stay in hospital when they don't need to be in hospital, when it's not in their best interest. The back door team, we have employed a system of anticipated date of discharge so that everybody who's involved in the care of that patient knows when we think medically they're fit to go home, and it gives you time to organise talking to families involving social care.
England has recently seen a worrying deterioration when it comes to delays in discharging patients from hospital, whilst performance in Wales has held steady. And again, money might be key here.
Wales has more GPs per head. It has more beds per head population than England. It hasn't, in the same way that England has, passed on the austerity to social services and local government in the way that's happened in England. So in many ways it has quite a lot going for it. I think what I would say is that despite that, it isn't quite getting the results in terms of the length of time that patients stay in hospital and how many people are admitted to hospital that we might have expected.
In the race to win power, politicians in Westminster and Cardiff Bay will continue to argue about the state of the Welsh NHS. But our view at the Nuffield Trust is this.
Healthcare systems are complex and making comparisons is really difficult. It's not obvious that one country is pulling ahead, but there are some signs of real concern for Wales.
The Welsh NHS needs to up the pace and more needs to be done to drive up performance, especially with public finances likely to be under strain for some time yet and demand only set to increase.